This is Dr. Fazil Ahmed. I am a liver and GI surgeon at South Asian Liver Institute. Naturally, I get a lot of questions about liver transplantation and liver diseases. So today I am here to talk about a few of those and answer your questions. But I have someone who I consider to be an absolute authority on everything about liver. He is someone with over 17 years of surgical experience in the UK, with 5 years at King's College, which is considered to be the top liver institute in the world. To his credit, he's done over 650 liver transplants and 250 complex liver resections with great outcomes. He has a keen academic interest, and therefore he has over 85 publications or published articles and 100 international presentations to his credit. He has spearheaded several programs across the country to make treatment for the poor affordable and available. He was also the first one to do a successful split liver transplant in combined Andhra and Telangana. More importantly, I consider him to be a visionary. He had a vision of transforming liver care across the country, and therefore out of that wish, South Asian Liver Institute was born. It is my great honor and pleasure to welcome Professor Dr. Tom Cherian. Hello, sir.
Fazil, thank you so much. I'm not sure I deserve all of that.
It's my pleasure to have you, sir. So let's get straight into it.
Sure.
When we talk, or when anybody talks about liver diseases,
Yes.
One of the most common and first things that comes up is jaundice.
Sure.
So I would like to ask you, what is jaundice and why is it so important to talk about jaundice?
That's a fabulous question, and I think something that everybody in the country needs to know. So jaundice is yellowish discoloration of the eyes, skin, palms, or any external part of the body. It is because the liver is not able to remove some of the pigmented toxins from the body, and therefore the levels of these toxins, they're not all toxins like bilirubin, these are actually useful pigments, increase in the blood, and then that gets deposited in the skin, which is manifested as jaundice. Now in dark skinned people like us, it is not so obvious on the back of your hands, but where it is fairer, like the palm of the hand or in the eyes, it becomes even more obvious. Now the question is, what does it mean? Lots of people get jaundice, and not all of it is worrying. If it is jaundice that comes and goes within 7 to 10, maybe maximum of 14 days, most of the time it is due to some sort of viral hepatitis like hepatitis A or hepatitis E that you can get from contaminated water and contaminated food. It is a self-limiting condition. It will get better. You don't need any treatment other than maybe a little bit of rest and a little bit of a healthy diet. But jaundice that doesn't go away, jaundice that persists, is something that should not be ignored. Then we are worried about illnesses such as viral hepatitis due to hepatitis B and hepatitis C, which is the more dangerous of the viruses that cause hepatitis. Of course, if you are somebody who consumes a lot of alcohol and you're getting jaundiced, that could be the reason why you're getting jaundice. And jaundice because of alcohol suggests quite an advanced liver disease, and one must be careful. Similarly, if you are diabetic and if you are obese or diabetic and obese together, then the risk is even higher of fatty liver disease leading to cirrhosis. And if you get jaundice in that condition, again, that suggests that you got advanced liver disease, or you might have advanced liver disease, and you definitely need to get investigated. So my point is not to frighten anybody about jaundice, but that simply raise awareness that if you do have jaundice and it is not going away, it must be investigated with simple tests. All you need is some blood tests which are not so expensive, and maybe an ultrasound to start with. And with just those two, a lot of information can be gathered.
So, at what stage would someone with jaundice, would it be a good time to come to us at South Asian Liver Institute, and how can we help them?
So like I said, if it is jaundice not disappearing by itself within a short span of time, I think definitely they will benefit from having an expert opinion. It doesn't have to be with us. Any good liver center is fine. If you don't live close to a liver center, then you can call us and we can do online consultations. So all options are available.
Right. So, as Professor very clearly explained everything about jaundice, there is not much to worry about, but at the same time it is equally important that as soon as you start experiencing these symptoms, you do get them investigated. And therefore, specifically for that, we have a very good program at South Asian Liver Institute called as the Liver Care Program, which is a unique and optimized program that helps us get better outcomes based on your treatment and investigations. So therefore, do contact us to know more about Liver Care Program. Thank you.
Thank you.